How you doing? Dr. Ulysses Jackson. Welcome back to another Mental Health Monday. I'd like to thank everybody who's been following me and sharing the links and hitting that like button. I'd like to thank you guys for that. Today we're going to discuss one of the most important relationships you're going to create in your life, which is going to be how to choose a therapist. When we talk about how to choose a therapist, this is someone that you're about to let into your life. You're going to let them know some real personal things about you. And you want to make sure that you're choosing these people right. So we're going to go with some things and some pointers on some avenues to go down, some things to be aware of when choosing a therapist. And I have to start this off with a disclaimer saying that please do not take this discussion as therapy or in place of therapy. This is an informational discussion that we have every Monday on Mental Health Monday. So to get right to it, the type of therapist you have is your licensed mental health counselor. Those are the most prevalent. A lot of people know about those right now, but there are other professionals that provide services, such as psychologists, social workers, and psychiatrists. They can all provide therapy, but there are differences in their training and their specialization. We'll get into the importance of taking the right therapist to help you address your issues. And most people could be better listeners than a therapist. But just because they're good listeners, they can provide advice and suggestions, but by no means are they therapists. So when you go into having some real issues, ask yourself sometimes, do I need somebody to talk to me and give me a suggestion? Or do I need a licensed professional to guide me in this area or in this situation I'm dealing with right now? So just be aware that a good friend and a colleague, they could be good listeners. But let's differentiate between who's a licensed therapist and who's a very good listener. Make sure you know the difference between a counselor who's giving you some therapeutic information versus someone that's giving you advice. So those are the things that we're going to be aware of, first of all, when we're looking at how to choose a therapist. The next thing is that there's some common ways to find a therapist, which go to your primary care provider or your doctor will have a list of people that he can refer you to. Then we go on the word of mouth. Then we go to friends and family members who may have heard about a therapist, heard about a doctor, or someone that may have had, good reviews. You might want to look into that when choosing a therapist. The next thing, when you find someone or you think you found someone that you're comfortable with, how are you going to pay for that? Or how are these services going to get provided? So that comes with tackling the insurances up front and find out if the therapist takes your insurance or not before you even want to begin to even think of therapy, because you may find a perfect match, but you're out of network. And it can be a financial burden for you to pay. So find out if financially your insurance is available or that you could afford the therapist. Again, since COVID has happened, right? The pandemic has led to many people needing mental health counseling and mental health treatment for various reasons. And this has also led to, prior to that, a lot of therapists would only do in person. There's been a large increase of telehealth. So for instance, I might have an office in Brooklyn and an office on Long Island, but most of my clients may be in Poughkeepsie, upstate New York, Buffalo, various places. No one's going to get up to have a session with me and drive from Poughkeepsie to Brooklyn or drive from Buffalo to Long Island. So the telehealth is something that's emerged and has been real common now when you're looking for a therapist. It can be done in person or telehealth. If you're an individual that needs or likes that in-person, face-to-face make sure you ask your therapist up front, what service do you provide? Or do you also provide in person? And if so, where's your location? So again, since the pandemic, a lot of things have went straight to telehealth. Next, make sure your therapist is knowledgeable in certain areas. You want to make sure when you find a therapist, you want to make sure they can address your needs. For instance, if you're dealing with severe depression, with suicidal thoughts, am I equipped to handle that? Is that something that I commonly work with? Or do I have knowledge to work with that? Or will I even have to refer you out? So make sure that the therapist you pick can address your issue, such as severe symptoms of post-traumatic stress. Have you worked with war veterans? Have you worked with survivors of sexual assaults? Have you worked with people that have been dealing with these type of traumas of post-traumatic stress? You may be dealing with bipolar issues. Has this therapist have experience working with manic and severe mood swings? These are things that you inquire when choosing a therapist. Psychotic symptoms and delusions and hallucinations. Have you been institutionalized? Are you coming out from some type of psychotic breakdown or hallucinating from, a disorder? Schizophrenia. Am I familiar? Or is your therapist familiar with this disorder? Managing anger and violence. Are you a DV, domestic violence perpetrator? Were you arrested for that? Do you have to take courses or work with a therapist on your anger issues? Make sure in your selection that the therapist is qualified or certified to handle domestic violence, anger management. These are all questions to ask. Also, if you're coming from a spectrum of severe substance abuse, whether narcotics, alcohol, or any other mood disorder substance, make sure you inquire with your therapist. Are you familiar with working with this disorder, with substance use? Next, you could also have complications, medical disorders such as diabetes, chronic pain, and things of that nature. We want to make sure all of these areas are addressed when you're picking this or, picking your therapist. You might have a family member that has dementia. How are you dealing with that? And how is your family member dealing with that? So today I want to just shortly, bring you guys up to speed on a way to look for a therapist, things to look for when choosing a therapist, and ultimately making sure you find that perfect match. Because this is someone where you're going to disclose some personal information to. This is someone that you're going to basically become close with and give some intimate details of your life to. So make sure you kind of vet them in a comfortable way when you're making your selection. Again, this is Dr. Ulysses Jackson. Welcome back to another Mental Health Monday, and I appreciate you for sharing the time with me today. Make sure you hit that like and subscribe button. Dr. Ulysses Jackson, How to Choose a Therapist.